Most parents don't miss the signs because they don't care. They miss the signs because they might be different than they expect.
And right now, more teens are struggling more than families realize. About 4 in 10 teens report feeling persistently sad or hopeless.
Silence is often the loudest warning sign. It's normal for teens to have mood swings, pull away sometimes, feel like they need some privacy. But what we look for is patterns, not just isolated events.
One bad day isn't the concern. It's when that day turns into a week, then 2, and it starts becoming a baseline of their day-to-day experience.
In schools, we often see it first. A student who's initially engaged becomes withdrawn, stops turning in assignments, starts missing days.
And what we know is that 1 in 5 teens have seriously considered suicide. And this is not just someone else's child. This is our kids.
Sometimes they're still showing up, but they're no longer participating, no longer themselves.
Some of the early warning signs parents miss are changes in appetite, sleep, motivation, and it might seem like it's laziness or exhaustion, but it's often much deeper than that. I often hear parents say they're being difficult, but what we're really seeing is them being exhausted or overwhelmed, and they're just shutting down because they don't know what to do.
Anxiety can look like avoidance. Depression can look like irritability. So not all kids feel sad. Some can look angry or disconnected.
We also see social shifts, students isolating, dropping friends, having conflicts with peers.
Sometimes it shows as risk-taking or not really caring about consequences the way they used to.
And high-achieving students, they're not immune. Achievement can actually hide anxiety.
If they stop talking, that's when you start listening harder.
And if these behaviors start to impact school, relationships, or daily functioning, or they last more than a couple of weeks, that's when it's time to pay closer attention.
A significant red flag is when your child seems stuck and they're unable to move past it despite wanting to.
Nearly 1 in 5 students report being bullied at school, and that can completely change how a student shows up.
About 13% of students miss school because they don't feel safe. That affects their mental health, their identity, everything. You don't have to wait for a crisis. Early support is always easier and more effective.
Stepping in early isn't overreacting, it's protection from additional harm. The first step isn't trying to fix things, it's connecting. Try saying something like, "I've noticed you've been a little off lately," or "I'm here if you want to talk." And if they don't open up right away, that's okay. What matters is they know that you're open and willing to talk.
And avoid jumping to solutions. Kids actually feel shut down when they feel judged or interrogated.
How you respond matters. If a young person feels emotionally safe, that alone can reduce risk significantly.
And the good news is that even one trusted adult can make all the difference when it comes to mental health outcomes.
And don't hesitate to reach out to your child's school, their teacher, their principal, their counselor. We are often seeing patterns that aren't seen a lot at home.
More than talking. Reflect back what you hear. That's what builds trust.
There are real resources available. Therapy, school support, community programs. You don't have to navigate this alone.
Sometimes support starts with a simple check-in or a conversation, and that step can change everything.
And consistent support at home, healthy routines, safe adult presence, and even prioritizing sleep are powerful protective factors for mental health.
And if something feels off, trust that instinct. It doesn't have to be you being sure of yourself. It just needs to feel like something might be wrong.